Hello, my name is Charisha Sola. I'm a student pharmacist. My journal club today is on Camrelizumab plus chemotherapy versus chemotherapy alone in patients with advanced non-squamous, non-small cell lung cancer. Subsequently, I will be referring to as non-squamous and SCLC. The primary objective of this study was to determine the efficacy of camrelizumab combined with chemotherapy over just chemotherapy in non-squamous NCLC Asian patients. The primary efficacy measure comprised of two primary endpoints, which were progression-free survival per blinded independent central review in all patients and patients who were programmed cell death ligand 1 positive. The secondary outcomes were overall survival, progression-free survival per investigator, as well as proportion of patients with an objective response, proportion of patients with disease control, duration of response, and time to response as assessed by blinded independent central review and investigators. This was a randomized, open-label, single-blinded, multi-center phase 3 trial carried out in 52 hospitals in China. 419 patients were randomized into two groups using a centralized interactive web response system. The first of the two groups were administered camrelizumab 200 milligrams given once every 3 weeks plus chemotherapy, while the second group were given chemotherapy alone. Patients were included if they were of the ages 18 to 70, patients with histological or cytological confirmed stage 3B to 4 non-squamous NSCLC without EGFR and ALK alterations were also included. Listed here are the other inclusion criteria. Patients were excluded if they had EGFR mutation or ALK translocation. Patients without radiographically measurable lesions were also excluded. Listed here are the other exclusion criteria. The duration of the study was dependent on the survival of the patients taking chemotherapy with or without camrelizumab. Patients were randomly assigned to receive 4 to 6 cycles of therapy, which had to be administered intravenously on day 1 of each 3-week treatment cycle. The follow-up duration was 11.9 months. Safety assessments and monitoring for adverse events were done once every 3-week cycle during treatment and every month thereafter. It was calculated that 412 patients in total would provide an 80% power to detect superiority of camrelizumab plus chemotherapy. The analysis of the primary outcome measures were done on a per protocol and modified intent to treat population with a one-sided alpha set at 0.01, with a risk reduction of 31% compared to chemotherapy alone. The progression-free survival was analyzed utilizing the Cox proportional hazard model with a 95% confidence interval, which was appropriate for this type of data. The type of data was nominal for all the endpoints. In terms of the results, the progression-free survival was significantly prolonged with camrelizumab plus chemotherapy than with chemotherapy alone. The 12-month progression-free survival was 49.6% in camrelizumab plus chemotherapy and 35.1% in chemotherapy group alone. There were a total of 143 deaths and 64 being camrelizumab plus chemotherapy group and 79 being chemotherapy group alone. As depicted in the graph here, the overall survival was far more than that of just the chemotherapy group alone. In terms of the tolerability, most patients in both groups had at least one treatment-related adverse events. The incidence of treatment adverse events were higher in camrelizumab plus chemotherapy than in chemotherapy alone. Among the adverse events experienced were decreased neutrophil count, decreased white blood cell count, and anemia. 5 deaths were recorded in Camrelizumab plus chemotherapy group, and 3 deaths occurred in chemotherapy group alone. These were all attributed to the treatment-related adverse events. Serious adverse events occurred in 36% of the patients in Camrelizumab plus chemotherapy group and 13% of the patients in chemotherapy group alone. The strengths of the trial were the power, which was set and met, the inclusion and exclusion criteria, which were adequate for the trial, the study was randomized, and the length of the study was appropriate to show the effect. The author's conclusion was supported by the results, and the superiority was based on valid parameters. In terms of the limitation of the study, the blinding was not adequate. The study was not a double-blind study. There were also investigational bias because the investigators registered the patients and assigned them based on the randomization obtained from the web response system. Both patients and investigators were not masked, so the treatment assignments were known by both groups. Although this study was a level 1 with major limitations, I will still recommend the use of Camrelizumab plus chemotherapy as a first-line therapy based on the following justifications. In terms of efficacy, the study was a well-designed level 1 trial that showed Camrelizumab plus chemotherapy was superior to chemotherapy alone in treating patients with advanced non-squamous and SCLC with negative EGFR or ALK. Camrelizumab plus chemotherapy also prolonged the progression-free survival of patients by 11.3 months. In terms of safety, although patients in both groups experienced common treatment-related adverse events, Camrelizumab plus chemotherapy improved patients' survival rate over that of just chemotherapy alone. In terms of cost, the cost of Camrelizumab plus chemotherapy is not yet indicated as Camrelizumab is still under clinical trial. As for chemotherapy, the cost of therapy depends on the type of cancer and the duration of the therapy. The cost of chemotherapy on an average is about $7,000 to $8,000 per cycle. In terms of special considerations and populations, differences in the proportion of male patients, patient's age, smoking history, genomic alterations, and immunologic signatures all contribute to outcome discrepancies. My recommendation to utilize Camrelizumab plus chemotherapy was primarily impacted by the safety, efficacy, and strengths of the trial. If there are any questions concerning this study, please feel free to shoot me an email at adesoc05@dyc.edu. Thank you for listening and have a nice day.